Hi guys, I'm Dr. Dawson. Today I'd like just to talk a little bit about the common dilemma of trying to tell the difference between a 3-day-old spider bite and a 3-day-old mosquito bite that's become secondarily infected, and ultimately a 3-day-old spider bite where the spider perhaps didn't wash his hands and the spider bite becomes secondarily infected. So this talk is primarily going to be for younger medical personnel, because this is something that's going to come up every month in your practice. And so we need to figure out whether it's an infection that needs to be treated with antibiotics or just a spider bite. This will perhaps help the occasional mom that finds herself in this predicament. And so you're welcome to come along for the ride. So the problem is the 3rd day of a spider bite, the skin will be red, hot, and swollen. And on the 3rd day of a spider bite that's become infected, the skin will be red, hot, and swollen. So these two are very difficult to tell apart. And the second one requires antibiotics, but we'd like to know the difference so we can avoid the unnecessary use of antibiotics. So the first thing will help is if we have a little bit of an idea of the natural course of a spider bite. And we're just talking about your garden variety spiders. We're not talking about black widows or brown recluses in this case. Those are rare and not the subject of the video today. We're just talking about your garden variety spider. So on day 1, frequently there's no evidence at all. Many times your child will not even realize they've been bitten. The bites sometimes happen when they're asleep and doesn't wake your child up, and there may be no sign at all. Sometimes there'll be 2 little small puncture bites, little puncture marks. Sometimes there'll be a little water-filled vesicle in the center, and frequently very little redness at all. By day 2, there's usually some mild to moderate redness and swelling, and the area may be a little warm. On the 3rd day, there may be more moderate to severe redness and swelling, and the area will have grown. And on the 4th day, it'll look about the same as it does on the 3rd day. And then on the 5th day, it'll start to look a little bit better. So that's the natural course of a spider bite. Keep in mind the venom is a little poison that was meant to kill things that are about this big. And fortunately, our children are not bigger than that, so it doesn't kill them, but it does cause a significant venom reaction, which is inflammation, which is where your body becomes red, hot, and swollen. And so that usually responds pretty well to anti-inflammatories, which is what a mild steroid cream will be. And so that's probably the best way to treat that. What we're trying to rule out is a secondary bacterial infection. So sometimes some of the bacteria can get into the bite and they can kind of set up shop and start a secondary infection, which is going to require antibiotics and pretty close medical follow-up in order to make sure that goes away. It's a little bit more of a severe and significant infection that we want to keep track of. Fortunately, there's a very simple way to tell the difference in the two. All you have to do is start with your finger and start 5 to 6 inches away from the red, hot, swollen area and run your finger lightly along the skin. And when you cross the border to where the skin turns red, one of 2 things will happen. Either your child will react with a moderate discomfort that comes along with the inflammation from the venom from the spider. And in that case, you just have a spider bite and you're just dealing with inflammation, and an anti-inflammatory like a steroid cream will be helpful. But the second option is as you go across that line, your child goes through the roof because it hurts like crazy. And if it's that kind of pain, that means you're dealing with cellulitis or a secondary bacterial infection that will require antibiotics, and it will require close medical follow-up to make sure that it doesn't get worse and require IV antibiotics or something stronger. So I know that there's a lot of confusion about this because in my practice, half of the time when I see spider bites that have been seen somewhere else the day before, they come into my office already on antibiotics, even though it's just a spider bite. And so my hope is that maybe we can all employ this relatively simple method and avoid putting the spider bites on antibiotics. So red, hot, and swollen, could be any of them. If it's super tender, that means it's cellulitis. And I hope this will help.